So, what is the best way to choose a doctor and to choose the doctor who does the follow-ups? Does it matter if it's an OD versus an MD? That's a question I get all the time.
That is an excellent question, and I think that our practice is probably what a great example of what a team sport this is.
Mhm.
When you talk about the surgical skill to put the implant in, this is something that physicians train for. We do surgical training. We do this on a regular basis, and that is a specific skill set. When we talk about the medical management that optometrists are trained to do, which is dramatic, there is so much skill, so much training, the ability to do an optical correction. If you want a great refractive correction, optometrists are the way to go. And for medical management of glaucoma and other things as well, the surgery is done by surgeons. But when we talk about what is the fundamental issue with the adjustments, it's a spot on, completely center of the target refraction. And Nick, you do an amazing job with this. I mean, there is no one better. And then even beyond that, it is the experience to know what patients will like. What is the likelihood that we're going to come up with a prescriptive correction based on experience that's going to optimize that individual's quality of life, and that comes from experience. And again, that is where the optometric side of this is such a huge plus. This is a procedure. A this is perfect for a team effort. And probably, it's almost like asking, okay, I had a knee replacement, but you know what? It wasn't my surgeon in the rehab clinic that strengthened my knee and
Mhm.
and got me back to 100%. It's like, well, no, there's physical and rehab doctors and medicine people who do that, and they do a really good job. And it's not the surgeon who got the knee put together, but now
Yeah.
that's not the end of the story. And so, should the medical doctor, the surgeon be doing the refractions? Yeah, of course, we're qualified to do that. We can. Quite honestly, I think the team approach in our practice has been so much of a benefit that I can't even imagine going back, because we've just had the ability to refine the outcomes in a way that I think would be difficult to reproduce any other way.
Yeah, there's definitely an art to this as much as there is a science. There's an art to the light adjustment process. A refraction is simple to do. It's the first thing we learn in school, but we're very well trained on it. It does come down to the experience of knowing which buttons to push, what dials to turn, and when to turn those dials and push those buttons. It's kind of like saying surgery is just as simple as taking lens out, putting lens in. There's an art to it, obviously. I'm not going to oversimplify it like that, but there's an art to both pieces of this puzzle. And I think the real team approach is kind of a beautiful thing, and we've really perfected that. And a lot of clinics work that way. And so I think it's really, important that you trust the team if you're looking for a team. RxSite actually has a clinic finder on their website that you can use and find who's in your area and
Mhm.
obviously do your homework. Make sure that you ask around and you trust that person. I think it really is important that you develop a relationship because I tell patients all the time, we're going to get to know each other pretty well during this process. I usually see them a little bit before surgery, at least have a phone call with them and then do all the adjustments. And that's 6 to 8 weeks of time where I'm seeing you every week. I joke with them that, hey, we're going to invite you to the Christmas party because you've been in the office so much. Make sure you understand that, that team is important and trust that team. But RxSite does have some tools that are available.